performance associated with ill health. A healthy nation is a happy nation. Freedom from disease is therefore a primary plank of our agenda to perfect self-government. We are committed to do affordably, inclusively, and in a manner that enables Kenyans to receive quality medical attention from the comfort of their homes. Towards this end, we are reforming the National Health Insurance Fund to meet the urgent needs of Kenyans at the bottom of the socio-economic structure by actualizing its purpose as a social medical insurance facility. Secondly, we have committed to deliver universal health coverage that enables every Kenyan attain dignified health care at the minimum cost of subscription fee. Thirdly, we have collaborated with county governments, whom we support wholeheartedly, and I want to commend all county governments for the exemplary work they are doing around health as a devolved function. We have collaborating with the county governments to recruit community health workers, promoters throughout the country. 100,000 of them will be recruited under this program, and this number will make every one promoter available for 100 households. This means that each promoter will be tasked with visiting Kenyans at their homes to determine whether any condition need to be managed through healthier lifestyle or basic medical attention. They will also be tasked with enabling patients with chronic conditions manage their medication, diet, and general well-being in a manner that makes hospitalization sometimes unnecessary. Finally, the promoters will facilitate early detection of conditions for referral to comprehensive attention in the spirit of effective healthcare management. Ladies and gentlemen,